3 million total knee replacements are projected to occur every year by the year 2030. Currently, more than 600,000 knee replacements are performed every year in the U.S., stated by American Academy of Orthopedic Surgeons on the website anationinmotion.org. Becoming progressively more common, total knee replacement surgery remains mysterious to many who have not had the procedure. Comprehension of this procedure requires the knowledge of the anatomy of the knee, the steps of the surgery, as well as the aftercare process. A full knee replacement or an arthroplasty is performed for many reasons. Arthritis or injury can cause serious damage to this crucial weight-bearing joint. When damaged, the cartilage in the knee wears away to sometimes the point where the bones scrub directly together. There are few alternatives when it comes to helping a patient who has experienced osteoarthritis to this extreme. Many people who choose to go under the knife do so because it has almost perfect turnaround rates. William Bennett, an orthopedic surgeon who specializes in invasive knee replacements procedures, said this operation provides dramatic pain relief for more than 90% of patients. This operation has become common and standardized. To understand how a full knee replacement works, one must first know the anatomy of the knee joint. Almost everyone knows the major components that make up the knee joint. They are the femur, tibia, and patella. Femur, tibia, and patella. Your femur is the biggest bone in your body. The tibia is also known as your shin bone, and your patella is your kneecap. The secondary parts of the joint are ligaments that keep the knee from bending the wrong way, tendons that hold the muscle to the bone, which aren't shown, and the cartilage that acts as a shock absorber. The other important parts to keep in mind of the knee are the meniscus and the synovial membrane. The synovial membrane vacuum seals the joint and is where the popping sound comes from in any joint. Once the basic picture of the joint is in mind, the actual surgery is slightly less complicated to explain. Any surgical procedure has many ways to be explained, but this is what I have personally gathered from Johns Hopkins Medical Health Library website. The patient is prepared for surgery and put under anesthesia. Countless measures are taken to reduce infection. The entire body is draped so that only one leg, the one leg that is being operated on, is exposed. It is sterilized, and the knee that is being operated on is the only thing left exposed. It is sealed with a sterile plastic wrap. The leg is laid straight on the table, and the surgeon marks it with a marker vertically and horizontally. These markings are to ensure the alignment of the skin properly after the surgery. The surgeon makes the incision around the patella all the way to the bone. The muscles, tendons, ligaments, patella, and skin are all pulled back with forceps, and the knee is put in a bent position and held there throughout the surgery by the surgical team. All ligaments, like the ACL and any bone spurs, are clipped off from the joint. The femur and tibia are fitted with metal guides, and the bones are sawed away so the prosthetic will fit. Peg holes are drilled into all three bones. The entire joint is continuously cleaned with saline to remove bone fragments. A trial prosthetic joint is attached to the femur, tibia, and patella. The surgeon then bends the knee to check the fit of the prosthetic. If they fit, the prosthetics are removed and permanent prosthetics are prepared. An antibiotic cement is applied to the joints, and the permanent metal prosthetics are put in place. The surgical team removes any excess cement and checks the patient's range of motion once again to see if it fits properly. The leg is laid flat for 15 to 20 minutes so the cement can dry. After this, the surgical team rechecks the patient's range of motion in the knee. If the knee passes, the incision is sutured following the marker lines from the beginning of the procedure. The surgeon will use staples or stitches, and a drainage tube is inserted to help prevent blood from building up in the center of the wound and help healing. After the procedure, the patient must stay in the hospital. The recovery time and side effects vary greatly from patient to patient, states Julie Creeman-Smith of the Journal of Behavioral Medicine. Once the patient has left the hospital, they must complete several months of physical therapy. A new knee is good for up to 36 million steps, according to Kirby Turnage, MD of Sacred Heart Joint Replacement Center in Florida. Once the knee Explanation of the anatomy, surgical steps, and recovery of the knee have been covered here. Overview of this information has hopefully relieved some mystery behind this popular surgical procedure. I would like to leave you in closing thoughts. If a high-density metal prosthetic lasts 36 million steps, how many steps do you have left on your organic knees?
That's your 4-page paper.